Hi everyone, Physician Assistant McKenna Duquette here, and today I wanted to hop on and talk about the point in my health journey that I knew that I was going to have to kind of take matters into my own hands a little bit more when it came to my autoimmune disease. So I have been diagnosed with rheumatoid arthritis since I was 4, have a little bit of like a complicated healthcare journey. At the age of 29, was diagnosed with melanoma, which can be a very aggressive skin cancer that was excised and whatnot, so it was dealt with, but I was still having some discomfort and some symptoms from my autoimmune disease. And so I was followed closely by dermatology for my melanoma. I was followed closely by rheumatology for my arthritis. And based off of my symptoms and my history, I was falling on an algorithm at a certain spot with my rheumatologist to choose treatments for me to use. And I kept falling in the category of immunologics or immunotherapy. And because of my history of melanoma, it kind of walked a fine line on making sure that you don't increase your risk or chance of repeat melanoma or metastatic melanoma, which certain medications can do, especially when they're starting to inhibit your immune system a little bit. And so my dermatologist had voiced concern in regards to starting those immunologics for obvious reasons. I was young and I had already had melanoma once. And they were concerned enough that they wanted me to consult oncology too, along with my rheumatologist, to kind of come up with best treatment plan. My oncologist voiced the same concern. And when I brought that back to my rheumatologist, I was met with a decent amount of reluctance in terms of choosing a different therapy based off of where I fell on the guidelines for RA and my disease state of where it was at. And so I think I just grew a little bit frustrated knowing that my main concern was obviously no one really wants to develop cancer, especially metastatic melanoma. It can be very deadly. And so I don't think I was being heard in terms of like my concern with that, balancing it with like controlling my autoimmune disease. And so that was the moment where I kind of decided to take it into my own hands a little bit more, a little personal, a little insightful in regards to my healthcare journey, but that's okay because if it helps anyone, I'm happy about it. But that was when that major change came in regards to taking control with diet, lifestyle modifications. And I will tell you that I have had a massive difference in my disease state, as well as my overall health and well-being in regards to making those changes. And so I wouldn't take it back. Everything happens for a reason, but that was my turning point.